Health Transformation webinar. We are coming at you live through Facebook as well as LinkedIn and on YouTube. And we will be recording this. So we will have the recording available later that we can share with interested folks. We want to talk with you today about the Rural Health Transformation funding that is available from the federal government. We want to go through some hints for you to prep and be successful in getting the grant funding for your tribal community. We'll talk a little bit about some ideas of what can be funded with the funding. We'll give you some ideas of projects that we've been involved in the past that can help maybe prompt you to think about some things that might work for your community. And we'll talk a little bit about just tribal rural health transformation in general, and kind of some trends we're seeing, maybe some things that you could be aware of as you're applying for this grant funding. So with that, let me just introduce myself briefly, and then I'll have our presenters introduce. My name is Debra Croswell. I lead Cayuse Native Solutions. We are a tribally owned company. We are owned by the Confederated Tribes of the Umatilla Indian Reservation. We are based in northeastern Oregon, and we are part of a family of companies that is about almost 800 employees strong now. And we do work for clients in the federal realm. We serve commercial clients, state and local, and as well as tribal clients and native-owned businesses and organizations. So a lot of different services we provide, a lot of in the technology area, some in the healthcare field. So we decided to come together and help tribes access this funding. And so we have a website that we want to encourage you to take a look at. It's called Tribal Transformation. Let me make sure I give you the right address on it. It is tribalhealthtransformation.org. And we want to encourage you to go take a look at the site. You can contact us through that site. There, if you go to the bottom on the main page, there's a way to contact us there with a phone number and an email. So anyway, I have worked for Cayuse since 2018. I am an enrolled member of the Confederated Tribes of the Umatilla. I was born and raised on the Umatilla Reservation, and that's where I still reside with my family. Before I joined Cayuse, I served for about 24 years with the Confederated Tribes of the Umatilla Indian Reservation. Worked in communication, and also in executive management. So with that, I will ask Christine and Michael to go ahead and introduce you.
Sure. Yeah, my name is Dr. Fitzmaurice. My background is peripheral nerve surgery, and as a specialist, I've dealt with people from all 50 states, a lot of rural patients. So I understand some of the issues involved. Particularly for me, it was a delay in treatment that, I can only imagine the outcomes would have been better if I would have seen these people earlier. And then, of course, dealing with the providers in these communities, just learning about the different issues involved in rural healthcare. So that was my initial background with dealing with them. And then, of course, was able to link up now with the with the Rural Health Transformation Experts Group to provide some clinical guidance for these groups. And it's been very rewarding to see the needs I've seen finally being met with funding. There was always good ideas, but there was not the resources available to implement these. So this is definitely a very exciting time. And with that, I'll pass it over to you.
Hi, my name is Christine Birmingham. I am the Managing Director for Cayuse Health, which is tribally owned by the Confederated Tribes of the Umatilla Indian Reservation. Cayuse Health provides professional health and medical support services for government and federal agencies. I first joined Cayuse back in 2021, supporting a contract with the State Department working in West Africa. And I've lived and worked all over the US and also abroad in Europe, the Middle East, Asia, and Africa. I'm a registered nurse, and I have private practice experience in urgent care, pediatrics, and internal medicine. My experience with the US government spans more than 20 years, and it includes work in a variety of roles. My experience as a patient myself, as a parent, and having worked in both private practice and with federal programs, I understand many of the challenges that people experience in getting access to healthcare. There are many unique demographics in the US population that don't fit the traditional healthcare model, and rural communities, being one of them. We're hoping that the Rural Health Transformation Program funding will help to close the gaps in health and medical care for these communities.
Okay. Thank you both for that introduction. I think to kick us off, we'll just talk a little bit about the funding in general, like what is the rural health funding, and really where is it at in the stage of rollout for particular states, and what does it mean in practice for tribal governments who really are trying to get that share of the funding? Michael, do you want to kick us off with that?
Yeah, so the total amount is, people throw around this $50 billion. This is guaranteed money. This is happening. All the states are getting this money. Now, each state is different, though, in how they are rolling this out. And so if there's an opportunity to sit at the state level before the state rolls out their RFP, their guidelines, that is certainly, a good opportunity. But sometimes they already have rolled it out. And then it's a matter of seeing where the state's guidelines align with your community needs. But this is all happening. This isn't, some people ask like, well, is this really? No, all the states are getting the money. Certain states are already rolling this out now, like Alaska has already started. So the key is to figure out where your community needs are, not just, oh, there's money, let's try and get something together, but where does your community needs align with where the state is looking to fund? And there are a lot of great opportunities with this. And then the next part of this process, which is critical, is the compliance part, making sure that if you are awarded these funds, that you are fully compliant, you're hitting these deadlines, and that the programs that you're looking at designing and implementing are actually successful. And that's what we're dealing with a lot of clients now, is that part, because that will affect your opportunity for further years in funding, because right now they're just funding this first year. So it's very important that we design and implement a very successful program to not only continue the funding, but also as a compliance, making sure that that you don't have to pay anything back. This is something that's often overlooked. And this is a very critical detail with this process.
Christine, do you have anything you want to add?
Yeah, I would add that, one way that our organizations can support communities who are looking to access these grants is by, tapping into our subject matter expertise, as well as that of those throughout our company. As Deb mentioned, we have in Cayuse Health, or Cayuse itself, upwards of 800 people. And we have a lot of resources to tap into. We can help you with things like credentialing. A lot of people think you just hire a provider and that fills the problem. Everything's solved, right? Like, oh, I needed a pediatrician. Let's just plug them in there. Well, there's other things in the background that you have to make sure are being monitored and addressed. And it speaks to Michael's point about compliance. It's very important to make sure that you are meeting all of the requirements that the federal government is putting out for these funds, because they will take them back. And so, we can do things like helping you with credentialing. We know from state to state, the rules are different, they vary, and we have people who have that expertise that can guide you through it. And that's just one example of a way that we can help you with compliance.
Okay. Let's see, from a clinical modernization standpoint, where do you see the biggest opportunity for tribes to use this funding to improve those outcomes quickly? Michael, you want to start us off there?
Yeah. So certainly with there's a couple of really categories. One is workforce, to not only get new providers there for the immediate needs, but also develop something long-term where you're training people in the communities. So this is a great opportunity for a long-term solution because the workforce, before, a lot of people rely on maybe traveling people, like traveling nurses. These are very expensive short-term solutions. So both relocation to have somebody there for the immediate need, but then also all these other programs to develop, whether it's CNA, other workforce, community health aides. There's all kinds of plans that are excellent at long-term solutions. The other is the technology component. This is a game changer, really, for these rural healthcare to not only provide, you think of technology and some people use telehealth as a word, but it's not only this video interaction, but this is all kinds of monitoring. This involves internet capabilities to access these resources. So there's a lot of great technological advances and with these funds that can provide great resources for the community. Those are probably some of the biggest advantages of these that can help these communities very quickly. Yeah, and I might add too that the telehealth, this isn't just with the practicing provider for the patient. This is also the provider to get specialized consultation immediately. This is an opportunity for, if you're seeing a patient with a certain issue, you can get an immediate consult with a specialist on how to determine and deliver the better care. So this isn't just like dealing with the patient. And these sort of resources were often delayed in the rural healthcare setting. So this is a huge advantage.
And I would add to that, there are, under the Rural Health Transformation Program, there's like 5 areas. And Michael mentioned the workforce development, that's one area, sustainable access, technology or tech innovation. And one of the big ones I see is the innovative care. The innovative care supports the development and the integration of what some may see as non-traditional care mechanisms and access, kind of also referring to what Michael was saying. You think telehealth, but also think things like, home care, or bringing the specialists to the patients, right, to their living room or physically to them. Also alternative and culturally traditional health and wellness practices. There's a lot of room in this funding to customize it and tailor it to your individual community needs. And I think that's the beauty of it. A lot of times federal programs are just rolled out and it's like a blanket program, and it really isn't a one size fits all, right? It doesn't work for everyone. And this is a great opportunity to use federal funds to address the needs of your specific community and address them in a way that is going to be impactful and helpful.
Yeah, absolutely. One of those areas that relates in there, Christine, is health literacy campaigns. Can you talk a little bit about communication strategies that you've seen work effectively with community members who may be hesitant to engage with the health system?
Yeah, there is a lot of hesitancy in communities throughout the U.S., variety of reasons for engagement with health systems, everything from maybe poor experiences of their own, past failures, suspicions, concerns, all valid. And I think one of the key things you can do when you're trying to get services to people or you're trying to help them access things is just meeting them where they are. The most successful community outcomes are built on an understanding of what your community needs. You can't, like I said before, you can't roll in there and just say, here's what you got. You need to find out, what do they need? That means finding ways to connect with them through social media if they access that, or your local community events, flyers in public locations, mailers. One of the best ways is through word of mouth. Even just picking up the phone or talking to somebody in line at the grocery store, like whatever it takes, you need to understand your community and how they want to communicate and what they're receptive to. We have more confidence in something if it is recommended to us by someone we trust. So whichever mechanism that is that you can get that to them, that's the best way, I think, is just meeting them where they are.
Yeah, good point. Want to talk a little bit about finding and keeping good staff. Michael, I know this is an area that nurse recruitment experts has a lot of experience with, and something that you guys have done exceptionally well. And Christine has done some of this as well. Let's talk a little bit about recruitment. That's challenging everywhere, but we all know, especially in rural and tribal communities, that is especially challenge. How can this funding help tribes build a stable long-term workforce? Michael?
Well, from a financial spot right away, like we just touched on, if you use traveling people or contract work, sometimes it's more expensive. So yeah, you can fill the immediate need. We've had success in Alaska with search where they were having these expensive issues and we were able to relocate 20 nurses and fill these needs. But that is the challenge with that is you can't just say, here's a good incentive bonus, come to this place. There's a lot of integration into the community and selling them on the wonderful aspects of living in the rural communities that they might not otherwise have. There's just a lot that goes into relocating somebody and having them stay in these communities. It cannot be just a financial incentive to them because that's not a long-term solution. So there are certainly some unique challenges with that, which we've been able to overcome. And we've had really good success. But this is also in conjunction with a long-term plan, which is to grow your own pipeline, if you want to call it, of training people within the community to fill these roles. And that's the beautiful thing about our organization is that, we've had experience and we have partners. Like I just got off the phone 30 minutes ago with somebody, and they specialize in certification and training for these sort of people, and they're certified in the States. Like that's the benefit of us, is that we have this network of people that we can put together to make sure these programs are successful. Because whenever we look at somebody with a need, we have to look at it in a couple different parts. And that's one of the flaws, is that people think of workforce as, just get somebody in the door. You have to look at both the immediate need and the long-term solution of training, educating these people within the community so they do want to take on these jobs and service their community, because that is going to be the best long-term solution, because they're already integrated in the community. People know them, trust them.
Before we ask Christine to respond to that, Michael, can you expound just a little bit on the work you guys have done in Alaska? I know there were some communities you had worked with to specifically design some campaigns and some recruitment strategies. Can you just talk a little bit about those?
It really was a matter of selling them on this, look at this opportunity in this beautiful area, people that had an interest in, yes, I want to be, in nature and do all these cool wilderness excursions and live that kind of lifestyle. And it's not just here's a job, here's some money. It's getting the people who are interested in living that sort of lifestyle. And so those are the people that are going to be more interested in take it and then stay there. So it's a whole, marketing campaign designed toward the right sort of people for that community. That's the objective. Again, because I've seen marketing campaigns, and I was even throwing opportunities my way. And it's enticing, like, oh, come here for a few years for a certain amount of money. But that is not doing the community any good on a number of ways, continuity of care, and there's all sorts of things we can get into. You need a long-term strategy. So the marketing campaign for that was really of community involvement for the people that were going there. So they have attachments to the community and integrated, and they wanted to stay. So that's the biggest, and that's why that was successful with that particular. And that was a big one. I mean, trying to find 20 nurses to go in that region is challenging. So yeah, so we've had good success with that.
Christine, what are some practical retention strategies that tribal clinics can implement?
Well, there's a lot. Again, going back to identifying what specifically the needs are in your area, right? So in some areas, it might be that there's literally nothing there, or they only have, schools are very small. In each community, you need to identify what the challenges are. So is it that you need specialists? You need, specific field to, maybe come out. Maybe you have a large diabetic population and you need somebody who is a nutritionist that can come out and work with the people. You also need to think about, like Michael said, those short 6-month contracts or 1-year contracts. It really is disruptive for patient continuity of care. You want to get people there that are going to stay there. And if you can't get them from within, which that is the most ideal way, is to get someone from your community to, get the training and the expertise who will come back and stay in the community and continue to support everyone. That's the 100% the best solution. But if you can't do that, then you need to figure out how to get the right person there and how to keep them there. And some of the things that we've seen that are challenges are things like housing. In some of the reservations and some of the rural areas, it's very hard to even just house somebody because there's, not a motel or there's not an Airbnb or, so that's one of the big barriers that we've seen. Also, things like proximity to schools. A huge one is the social community. I think if you do have to bring someone in from outside the community, it's really important that you help them to kind of integrate and become part of that community. Because when you have those community connections, it really makes wherever you are just that much more enjoyable, and you're more likely to stay. If you don't talk to anybody in the community and you don't interact, you don't attend events, you don't do anything, you're going to be looking for the next thing and you're going to leave. So it's really important that you build those connections and try to keep people there for, again, continuity of care. Things that we've done in that realm is just investing in people. We find out what the needs are for those providers. Sometimes they don't have the resources at the clinics that they're working at. Maybe they don't have the right equipment, or they don't have the right tools to be able to assist their patients. It can be very frustrating as a provider. You want to help your patients, you want to help your communities. And if you don't have the tools to do that, it's just disheartening. So looking at those things and developing specific tailored programs for your providers to engage the client, the community, and support best practices for the patient and provider are really, really helpful. We have various backgrounds that we do partner with other people. If we don't have the actual expertise, we can also tap into those, just like Michael mentioned. So, there's a lot of different things that you can do, and we would love to kind of hear what your challenges are and help you with them.
Yes, good point. Before we talk about modern tools for healthcare and better care for communities, I just wanted to remind participants, let them know actually that we're not able to take questions today live here, but if you do have questions, we would love to have you go to our website, which is tribalhealthtransformation.org, and you can contact us directly through that website, submit your questions there. We would love to connect with you and offer those answers to your questions that you might have about rural health funding. So let's go back and talk about modern tools for healthcare. Michael, telehealth has become essential for rural healthcare, as we all know. What are the most impactful telehealth investments that tribes can make with this funding?
Well, it goes back to the idea people think when they hear telehealth, they think, oh, you're doing a visit remotely and you have a computer monitor. While that is a component of it, some of the most fascinating and I find clinically useful things lately are things like remote monitoring, because you can monitor glucose, oxygen saturation, blood pressure, a variety, and there's more and more on the market. There's a vendor who has this pediatric kit where parents can look in the ear and it can get real-time data to the pediatrician. Like, these are game changers. So the remote monitoring allows the providers to detect things early to allow a much more effective treatment option. So these are not building up. So the person's not waiting 6 months or a year to be seen, and then all of a sudden there's this big issue. So this is a game changer for providing care in rural communities. And there's more and more of these. The states love this technology. Thank goodness they're getting this money out there. So there's that aspect of it. And then there's the other aspect, like I mentioned, about for the provider themselves. If you're a primary care doctor, you can get an immediate consultation with a specialist. And we have a partner right now that has this platform set up that we can integrate, that they can get a real-time consultation within a minute. They can document in the notes. Then they can also set up a telehealth for the patient that they can be seen by this specialist. So these are things that a couple of years ago, these were not available. So not only are they now available, there's funding to implement these. Another key thing specifically for tribal organizations, and it's worth pointing out, is that these funds can ensure that the tribe maintains control of the health data, that this is not given out to the state and private vendors. So if a tribal organization implements these, they have full control over this. So that's a very important distinction, because privacy is a huge issue. And then they can then use this information to develop good guidelines for their community and detect things that are happening in their community so they can further implement programs in the future for that. So there's so many cool things when you talk about telehealth in general that can help out these communities.
Yeah, I think that's a great point, Michael, that, people hear the word telehealth and they just kind of think one track thing, but I think there's so much more to that. And I'm glad you brought that up. Christine, I think you probably have some thoughts to add on this about just generally modernizing healthcare related equipment, such as EHRs, diagnostic tools, even broadband in the community. How do you see those helping with better clinical outcomes?
Well, I do have to agree with Michael about telehealth. I think one of the best things that came out of COVID was just the growth of telehealth and the opportunities that we have with it. It has made it so that people who previously could not reach certain types of healthcare are able to get to them. One example I knew of was I had a friend who had a teenager at college, and their insurance only covered, specific mental health providers within, a 50-mile radius. And the closest one was 75 miles away. It was ridiculous. And so you had somebody who was actually looking for help, who voiced it, wanted mental health help, and they were completely unable to access it because they were just, a college student without a car at a campus too far away from a provider that qualified. Telehealth and all these technical and digital capabilities are changing that game. They're making it so that somebody who cannot reach the services can now reach them. You have to give people access, and access isn't just about reaching a website or a patient portal. It's also about helping people to navigate them. as was mentioned earlier, if you don't know where to look for things, having access to all the tools in the world will do you no good. It's absolutely useless. The Rural Health Transformation Program funding is an opportunity for rural communities to essentially level the playing field when it comes to healthcare. It's opening up access. It's helping with disease prevention and addressing chronic disease management. These funds can be used in so many different ways. And I think one of the greatest ways is modernizing all of that equipment, your health records, your diagnostic tools, all of those things.
Yeah, and those can be things that can last for years for communities. So yeah, likely good investments with this funding. Michael, what are the biggest mistakes that you want tribes to avoid as they pursue this funding? As you've been talking to different groups about it, I'm sure your organization has come up with some ideas about different pitfalls or things they may want to avoid or just be aware of as they're getting ready to put in for this funding.
Yeah, there's a couple. I think first we kind of touched on it is if you see the funding, try not to pursue money without a very clear clinical strategy, making sure that your funding you're trying to obtain is truly looking to solve some issues in your community, which I think most people are doing a good job, but that is just something to be aware of, that just because there's money out there, because again, there's compliance issues. So we have to develop a great program and making sure it's utilized. So that is certainly one, making sure everything is in alignment with what your community's needs actually are. The other we kind of touched on is workforce is not a single entity. Like workforce is multiple phases. This is relocation combined with training for long-term solutions. So when we think of workforce, we're really looking at this. The end result is a very long-term strategy that can be self-sustaining. And the issue again with the compliance is again something that things have to be on a certain deadline. These strategies have to be implemented in a way where they are utilized by the community. These are huge issues that we can work on, but they can't be overlooked because, again, this affects funding in years 2, 3, 4, 5, and also you might have to pay some money back if these aren't implemented correctly. So those are definitely some things that shouldn't be overlooked.
Sure. And how, before we have one last question for each of you, I just want to hear your thoughts, Michael, on how we go about, what are some things that we can do as a group here to help tribal communities as they're thinking about applying for these funds? Are there some ways that we can specifically help?
Well, really, it's a matter of sitting down and we kind of look at what their goal is, how does it align, and then if it does, we have all these resources available with our experience and partners that we can make sure all these little gaps are taken care of, that nothing is truly overlooked. We've thought about these things. We may have thought about things that they may not have considered that could affect, how impactful these are for the community, and then more importantly with the compliance. So
yeah, basically we can help set them up for success to get funding, but also down the road when it comes to reporting and compliance and all of that. So those are areas that our team is skilled in and has experience in. So let's kind of start wrapping up here. One question for both of you to answer. Maybe Christine, I'll start with you. What does tribal health transformation mean to you, and how do you envision this funding helping towards that vision?
Well, tribal health transformation is an opportunity to close the healthcare gaps, that are identified by tribal communities by creating sustainable access to services, as Michael mentioned, sustainable access to programs, bolstering your workforce development from, not only from outside, but within, addressing critical infrastructure needs. The funding through the Rural Health Transformation Program will allow tribal communities to augment their programs through federal grants that have been specifically carved out to support their communities. This is a unique opportunity to make some of the changes that, you know, tribal communities have known that they need and they want. This is the chance. This is the opportunity because the funds are there.
Michael, your thoughts?
I think Christine was looking at my stuff I wrote down. No, I'm just kidding. I couldn't agree more. The phrase I would say is something that if you consider it like closing a gap between what we have available with modern healthcare. We have these tools, we have these resources, and it's closing the gap between what we have and providing it for the rural communities. They just didn't have access. They didn't have these resources. But we have all these great things available. So this opportunity is available, is now we're able to provide this care to these people who did not otherwise, they weren't able to receive this.
Yeah, so the opportunity is large here for tribal communities and health practitioners who want to have some lasting impact for their communities. We'll go ahead and wrap up at this point. Again, I would remind folks to check out our tribalhealthtransformation.org website that we've set up for our partnership. And on there at the bottom of the first page, you can find a way to contact us. That will come directly into my inbox. So if you have questions, you know, from this webinar or just in general about the rural health transformation funding, drop us a line, give me a call. We can set up a meeting with our team to chat about your ideas that you have for the funding. We can give you some feedback. We can, again, help you kind of get set up for success to apply for that funding. Christine and Michael, I want to thank you for joining us, and we will be recording. We have recorded this, and we'll be providing it out on our social media. I know Michael, Nurse Recruitment Experts, will be also putting it out there on your networks as well. But anyway, thank you everyone for attending, and we look forward to meeting you and learning how we can help. Thank you.
Thank you.
Thank you.